It's an honor and privilege to stand before you today to mark a significant milestone in the City of Richmond's journey towards becoming an employer of choice. As we continue to prioritize the well-being of our valued employees, we are thrilled to announce our partnership with Marathon Health, a distinguished leader in employee-sponsored healthcare. The City of Richmond recognizes that our greatest asset is our workforce. Investing in the health and well-being of our employees is not just a commitment, but a strategic imperative. Today, we take a giant step forward in this commitment by joining hands with Marathon Health, a beacon of excellence in the healthcare industry. Absolutely. Marathon Health's reputation precedes itself, partnering with over 200 organizations nationwide to provide top-notch healthcare services. Their commitment to delivering high-quality, affordable, and convenient care aligns seamlessly with our vision for a healthier and happier workforce. This partnership is not just about medical care. It's about fostering a culture of wellness, prevention, and proactive health management for our employees. By providing our employees with access to Marathon Health's expertise, we are not only investing in their physical well-being, but also empowering them to lead healthier lives, both at work and beyond. I'd like to express my gratitude to Mayor Stoney. Your support for this effort is invaluable as we strive to enhance the health and vitality of our community. Round of applause for Mayor Stoney. I know this day didn't come easy, but I am sure glad we're here. I also know that we wouldn't be here without the tireless efforts of several key staff members and departments. And please give me a moment, because it is a long list of folks who are responsible for enabling this day to happen. First, our Department of Human Resources, Tyrone Alexander, Robin Redmond, Paulette Giambalo, and the rest of the HR team. City's Department of Procurement, led by Renee Almaraz, Jerry Tuttle, and the rest of the folks who provided guidance and support throughout the RFP and contracting process. Our fantastic city attorney and city attorney's office, Laura Drury and Susan McKinney. Without their unwavering support, we would not have gotten over the finish line. Our finance director, Sheila White, as well as Jeffrey Crawford on her team, who have led us through the whole RFP creation and evaluation process, which is a lot of work. Our planning and permitting department, planning director Kevin Vonk, our director of public utilities April Bingham, David Alley, our commissioner of buildings, Karen Paquette, and their team. Without them, we could not be here opening the doors today. We have some great stories about what the last 48 hours have been. And last but not least, certainly not least, our DCAO Finance Administration, Sabrina Joy Hogg, with the support of Louisa Meyer, Cynthia Osborne, and Jessica Singer. I can say without certainty that we wouldn't be here today if it wasn't for Sabrina, her vision, bringing her experience with health clinics from other localities, and laying the foundation for this to happen today. So a big thank you to Sabrina. And to all the individuals who served on our evaluation team, to Betula Burks and the communication staff, we thank you for all that you've done to get us here today. But finally, and certainly not least, to all of our employees, thank you for your dedication, your patience, your hard work as we work on this path to becoming an employer of choice. Today marks just the beginning of a healthier and more vibrant future for each of our employees. With that, I look forward to cutting the ribbon, but before that, I would like to bring up Mayor Stoney for his remarks, and again, just to say a sincere gratitude for setting the vision of what this city can be for our employees.
Give another round of applause for our Chief Administrative Officer, Lincoln Saunders. You heard Lincoln state the number of people it takes for a project like this to get off the ground. And that's the sort of culture that we've been trying to forge for many, many years. And as you all know, culture eats strategy for lunch. Sometimes breakfast too. So it takes everyone being on the same page. And so I want to begin by me offering a round of applause to all those involved, right, from the bottom to the top, who made this all happen today. Thank y'all very much. We also know that our city is only as healthy, only as strong as those who care for our city. We in city government are those who care for our city. That's why today marks an important day here at the city of Richmond, one that highlights the city's deep commitment to prioritizing and uplifting the health and well-being of our employees while ensuring access to quality, accessible health care. By partnering with Marathon Health, which is a leading provider of direct primary care for employers all across this nation, the city is able to expand access to high quality primary care for our employees, for their families, all while reducing the cost of care. The city of Richmond is the first organization to join Marathon Health's new network model, which strategically places health centers where employees live and where they work. By joining the network, the new health centers in Richmond will provide over 3,300 city employees and their families with enhanced access to medical services. I'm particularly excited about the partnership because it ensures that proper care is accessible to all city employees by offering convenient care at their workplaces. Additionally, recent studies have reported that on-site clinics can reduce healthcare expenditures, promote trusting relationships among employees, and also boost productivity. We like the boost productivity part. Ultimately, this partnership and the expansion of services to our employees will help both prevent and reduce illness and disease in our community, and I'm thrilled all about that as well. So, thanks to all who were a part of this work and to all who played a central role in promoting the physical and mental well-being of our employees. And I want to give a special thanks to Sabrina Joy Hogg, our Deputy Chief Administrative Officer for Finance and Administration, and my friend, the Chief Administrative Officer, Lincoln Saunders, for their vision and for their hard work. This team right here has been responsible for investing in the human capital of the city of Richmond. You've seen salary increases under their watch. You've seen paid parental leave expand under their watch. You've seen mental health days added to your calendar under their watch. You've seen the transition from RRS to VRS under their watch. And you've seen us shift from being the second choice or the third choice to being the employer of choice in Central Virginia. Let's give them a round of applause. And it's my pleasure now to ask that Chad Ashcraft, who's the Chief Growth Officer at Marathon Health, to provide a couple remarks at the podium as well. Chad.
Thank you, Mayor. Yeah. Thank you, everyone. I'll just have a few words before we cut the ribbon and open this new center. This center, we've been in Virginia, partnering with other employers for over 10 years now. This is our 13th health center, but in particular, there's some firsts, in particular this health center here, that I want to call attention to. You heard the mayor and Lincoln talk about this being the first client that's partnered with us for the network of health centers, and it was the vision of the city and the various departments kind of really coordinating and organizing around this notion of bringing this kind of service to the market, which will certainly impact the lives of their employees and other employers in the market as well. But the other first involved here is this is our first site in Richmond, Virginia, in the Richmond, Virginia area. It's the first network site in the state of Virginia. It's the biggest site that we've ever built in our networks, right? So I know Sabrina is very proud of that too. The largest site of 6,000 square feet that houses the most robust scope of services we've ever offered in a site like this. That include, in addition to primary care and acute care, a full pharmacy offering, which is the first time we've done that in a network offering as well. The full public safety and first responder services, which is a scope that's dedicated for the specific needs of that population and the demands of their workforce and job. Behavioral health specialists and mental health care, health coaching, and physical therapy. So we have not yet packed in that large of a scope into a building this size in any other market in the country. So we're really happy and excited to be able to unlock that today. In addition to having the other sites, we have 2 more sites to open up over the next couple months around the city, and many more after that. So thank you very much.
Before we cut this ribbon, I would be remiss if I didn't also recognize this is never a one-man or a one-woman show in city government. We cannot do this without our partners on the Richmond City Council. Let's give a round of applause to Vice President Lambert's with us today, and Councilwoman Catherine Jordan representing the Richmond City Council with us today. Now, let's cut this ribbon.